Good afternoon, and thank you for joining us for today's wonderful presentation. My name is Kayla Rogers, and I'm an Education and Outreach Coordinator with the Women's Fund. For those of you who are not familiar with the Women's Fund, we are a not-for-profit organization in Houston, and we provide women and girls with the tools they need to be advocates for their health. So we do this through focused seminars like today's presentation, as well as curriculum-based classes and publications. Our programs and publications are free. If you're ever interested in learning more about the Women's Fund, upcoming presentations that we have, hearing a little more about our programs, or even requesting publications, you can visit our website, thewomensfund.org. The link below is a direct link to our publication page where you can request physical copies or download PDF versions. We have publications available in both English and Spanish. So to kick off today's presentation, I'm so sorry about that title. I forgot to change that from last time. I apologize. We have Maureen Beck here. Maureen is a gerontological nurse practitioner. After graduating from Duke University, her focus was pre and post cardiothoracic care and intensive care. After moving to Texas, she became an ICU head nurse. In 1992, she earned a Master of Science in Nursing as a gerontological nurse practitioner and provided primary care in a geriatric assessment center and house call program at Memorial Southwest. She assisted in the training of family practice residents and nurse practitioner students. She participated in the White Conference on Aging, appointed by the Governor of Texas in 1995. In 2009, she joined the Division of Geriatric and Palliative Medicine. She assisted in the planning and opening of the Center for Healthy Aging, and today she provides primary care at the center and through the house call program. So Maureen, we're so happy to have you here today as a part of our Brain Health Awareness series. And I'm going to go ahead and turn the floor over to you.
Great, thank you very much. Hopefully I'll not freeze during this, but there's always a possibility. I'm at the McGovern School of Medicine at UT Health in the Division of Geriatric and Palliative Medicine, and fortunate to be faculty there and participate in the education of not only medical students and residents, but also nursing students at the Cizik School of Nursing. I'm really happy to be here today and participate in your brain health agenda. I've adapted a set of slides that another faculty produced and added some of my content to it. So it'll be a little bit of two people's agenda on brain health. And I'm gonna start now. I'm gonna share my screen. I hope, come on. That is not what I want to share. Hold on a second. Here we go. That is not being shared, I don't think.
We could see it whenever you popped up the PowerPoint.
I'm sorry. I need to find the right thing so I can share it with you. I had it all ready to go, everybody. Promise. May have to send it to you to get it. Okay, so we're going to take a little time with me just sending this off.
Okay.
Hold on one second. Brain health is a really important component of what I do. In our clinic, we evaluate people for dementia and also work closely with our with our neurological partners in doing very advanced assessments. Could you send me your email again so I can just send it back to you? Within our clinic structure, we provide primary care to people who are pretty much 65 and older. Some folks come to us wanting to maintain their health, age very well, do all the right things to avoid problems as they age, stay in their home, for instance, and age in place. And then others come to us who already have problems. They already have problems with memory and not sure what to do. And they come to us at different stages of memory loss. And I believe you've already had an opportunity to hear from the Alzheimer's Association. And I will be touching on a little bit of that. So I'm sending this file right over now, and hopefully we'll get this shared on the screen. A lot of people worry about memory loss. There's some memory that just happens naturally with aging. Then there's particular things that we see when people come into the office or family have noticed that cue us into doing more advanced assessments. We're going to talk today about what brain health is. And in fact, there is no universally accepted definition of brain health. Some organizations like the U.S. Center for Disease Control have defined it as an ability to perform all of the mental processes of cognition, including the ability to learn and judge, use language, and remember. And the American Stroke Association has defined it as average performance levels among all people at that age who are free of known brain or other organ system diseases in terms of decline from function. It's kind of complicated too. Are you able to share my screen?
Yes, so I just got it and I'm going to go ahead and open it up now.
Okay.
So you can just let me know when you'd like me to advance to the next slide.
Okay, so I don't know if you can see the whole thing, but there's a lot of black squares coming up on this. I don't know if you can stop that, but so we entitled this Protecting Your Memory in Today's World. Next slide, please. So here's some facts about normal aging. Remember when being 100 was something that was very noteworthy? When I was a kid, they would have it on national news in the morning that this person, maybe 3, maybe 4 people turned 100. And they would every once in a while, mention their names and maybe have a photo of them. Well, that is no longer TV worthy. We have so many people who have reached 100, going beyond 100. It isn't unusual anymore. Our population of people over 65 is rapidly growing, and the population of folks who are 85 and older growing even more. All baby boomers will be 65 and older by 2030. The population of people 85 and older on the screen is going to more than triple from 5.4 million to 19 million. That's a lot. And we don't have enough caregivers for all the people who are aging, including myself. And in Texas, we've got some statistics to share here too. The population is going to increase from 2000 to 2030, 59.8%. But the population of those 65 and older is going to increase by 150%. So that's an incredible difference. Next slide, please. So as I said, we're not going to have enough caregivers. The older population is going to outnumber the children. Birth rate's definitely declining, and that definitely will impact how you are going to get care as you get older. And our life expectancy has changed also. Around the time my mother was born, it was 11.9 years after the age of 65. And now it's increased quite a bit. We're all going to have to work longer. Next slide. This is a little picture of where the highest aging population exists in the US. As you can see, we've got the Northwest, the warm and sunny Flagstaff, Arizona area, the farmland, middle of the country, the San Antonio to Austin area, Kerrville, and then look at Florida. We all knew Florida was going to be on the map, right? Next slide, please. So we have a lot of changes in our body, not just in our brain. As we age, we have increased fat, less muscle, unless we're super exercisers, we exercise regularly. Our metabolism is going to change, and that will affect the way we use medications. It may mean that some meds that we're on need to be stopped because they become more toxic to us. We, of course, have changes in our senses. That means we have difficulty sometimes tasting food. We may have lost our sense of smell, not just because of COVID. There's also a loss of hearing that occurs, maybe not completely, but a loss of the higher frequencies, which means it's harder to hear a woman's voice than a man's voice. Many people resist getting hearing aids, but social isolation is very much an impactor on healthy aging and a healthy brain. So when you become isolated because you can't hear and don't understand what people are saying, you could very well lose that contact that you need to keep involved in, have a good resource and a secure system of folks who can help you. Your personality probably isn't going to change very much. There may be some psychological changes, but likely not. In your heart, your cardiac output may decline a bit. Your heart muscle may not be quite as strong. We find that folks do pretty well till their 80s when they have a more increased likelihood of having an irregular rhythm, the kind that you see advertised on TV all the time. Heart valves tend to not work quite as well, and the irregular rhythms, they can happen. Endurance might go down. As far as your lungs go, they usually do pretty darn well, except the muscles and structures of your rib cage tend to become more stiff. People breathe differently. They don't take as deep a breath. Potentially your ability to take a deep breath can be reduced because of chronic illnesses that you adapt to. And their GI system is going to change. I would guess that many people associate aging with constipation because we hear about it all the time from our older relatives, or they talk about it all the time. The gut tends to slow down. Sometimes the appetite can decrease just naturally. And the transit of food from the time you eat it till the time it comes out, when it slows down, people get constipated. Sexual function. There can be some changes there, but surprisingly, people still do have sex in their 80s and up. Certainly not everybody. It becomes more difficult, and there's some changes that occur that make it more difficult. A lot of medications and a lot of focuses on sexual health today, particularly with advertising on television. Next slide, please. So here we get to memory. You've been listening to folks talk about memory already. It's your ability to store and retain and recall information. It's your hard drive. Memory is very essential for carrying things out during the day, from remembering a recipe to taking care of your bodily functions. And as people develop problems with their memory, they become more dependent on other people to do those basic things for them. Your memory is essential for all aspects of your life, especially safety. And driving a car requires that you remember what you just saw before you take off across that intersection. Memory can be affected as we age, but little things like misplacing your keys or forgetting a name can cause people to become anxious that they're developing problems with the memory. Next slide, please. Here's a slide you may have seen already that kind of compares a dementia like Alzheimer's with the typical aging changes that anybody can have as they get older. Making bad decisions every once in a while, as opposed to poor judgment and poor decision making. For instance, contributing to a charity every month, forgetting that you already did it, or being a victim of financial abuse because you're not able to make good decisions about who is helping you with your finances, or not understanding the threat of fraud or the threat of abuse that can occur. Missing a monthly payment. Well, sometimes our patients who have severe memory loss or moderate memory loss still try to manage their finances and can no longer manage doing the online or the computerized tracking of their billing or online banking, or even doing emails. So occasional missing a payment, not to worry. Forgetting which day it is and remembering later. Well, it tends to be that folks who have memory loss don't know what month it is, what year it is, what day it is. They will often tell me it's 19 something. They go back to what they're familiar with, I should say. Forgetting a word every once in a while, or forgetting the name of an item like a pen, or calling it whatchamacallit. If that happens occasionally, it's not a big deal, but we do find word finding and facial recognition is a big loss for people who have dementia. Losing things from time to time, very different from misplacing them every day, and forgetting to take your medications and things like that. Next slide. I forgot to make a backup copy of my brain, so everything I learned last semester was lost. Now that's a slide from Dr. Atai, and wish we could make a backup copy of our brain. It would be very useful. Next slide. So we find that our culture, of course, is so changed from the time that most of my patients grew up. They may have been around in a time, our oldest patients, where they were actually still using horse transportation. If my mom was alive today, there were horses in their streets. She actually used an outhouse in town, and she lived in the East Coast. Going from an old-fashioned phone to a cell phone, what an amazing change that has been for our patients to go to something like that. Not have to be tied to their house to talk to somebody. The fast pace that we have today was not around in the 1950s. Our values of individualism and autonomy and our personal success sometimes can prevent people from talking about the memory problems that they actually have. People are very competitive, and they do really value their privacy. Sometimes it's very hard to get patients to talk about memory problems they're having because they don't want their kids to know, or they don't want their spouse to know. Sometimes they don't realize that their family's already seen these changes, but we're afraid to talk to their parents about it. Next slide, please. So we have so many schedules, so many appointments, certainly not always punctual, and people change, move. Our families are in different parts of the country. It makes it difficult to have caregivers and support for patients who have memory loss. Oftentimes, our patients have to move to where their children are, and then they have to develop a whole new set of support system folks, from the pharmacy to their doctors. They lose the neighbors they've always had. Schedules could be more difficult to keep up with. Most of us keep our schedules on our phone, when patients resort to calendars that are posted up or maybe on their desk. It's hard to be punctual too when you're older and you're depending on other folks because you might have some memory loss. You're depending on them to get you someplace on time. Our older patients seem to be very insistent on being on time and being respectful for other people's schedules. When they're late, it makes the blood pressure go up. It really has a lot of consequences for our patients to depend on other people. And of course, in Houston, we're always closing a road down. And my office is very close to 610 and 59, which means that for a whole year, my patients are going to be late. So, yeah. Next slide, please. So we are using our brains so much to keep track of all the things that we have to do. 52% of Americans would sacrifice a day's pay for another day off. And of course, we're always burdened by piles of paper and mail, unless everything for you is coming online. We don't really have time for fun. Next slide, please. So we think about memory disorders. We go from, I'm worried about I might have problems with my memory, my mom did. It's a little bit of forgetfulness. And then people who really do have problems move into a stage called mild cognitive impairment. Now we can measure that on one of 3 or 4 scales that we have if we do a cognitive test in the office. Mild cognitive impairment is just below normal and just above dementia. But there's not too much we can do about it. We don't have medications for mild cognitive impairment. People may notice that the little things that worried them are real, forgetting appointments, misplacing things, but they do it so much more than they did before, but they're not at the stage of dementia. Some physicians and nurse practitioners are treating mild cognitive impairment with dementia medications, but there's no evidence to do that at this time. And of course, there's side effects for those drugs. A portion of people with mild cognitive impairment will proceed to have dementia. It isn't a given that someone who has mild memory loss is going to develop dementia. Next slide, please. So there's a lot of talk, literature, and ads for anything from exercise to drugs to vitamins to help improve your memory. But let's look at some causes that could happen that we try to reverse that could impact memory. As I mentioned before, being alone and being depressed, that hits your lifestyle and psychological, can impact memory. People who are depressed will have problems with their memory because they really don't care to even try to remember or answer the questions on my cognitive evaluation. They just give up. They don't care. They don't want to try. Being isolated at home and not having interaction with other people, that can impact your memory. Substance abuse for sure. Now, we're not talking about a glass of wine a night. We're really talking about several glasses to a bottle to a big, huge bottle a week of alcohol. And of course, street drugs, not meds, can impact your memory. Long-term use of alcohol, as in alcoholism, can give you a dementia. Medications definitely can impact memory. And some of them are just over the counter. Benadryl. So many medicines have PM on them right now. Benadryl can impact memory. Medications that are used for incontinence, the old ones, can impact memory. Anxiety medications and prescribed medications. Sometimes the doses can be too high. Sometimes just the medicine itself that you need to have can impact your memory. Vitamin deficiencies, particularly we're looking at vitamin B12. A very low vitamin B12 or one below normal can permanently impact memory. So even though we try to get that number back up with supplements, we may not improve memory in people who have a B12 deficiency. And then of course there's organic disorders. People who are having anemia or hypothyroidism, cancers, brain cancer particularly, will suffer from memory loss at times, depending upon where in their brain it's affecting them. So we look for several things that we could correct when we have somebody come in with memory loss. We want to help them have a healthy brain. So before we say you have dementia, we look to see, are they anemic? Is their thyroid working properly? That is, working too much or too little. Are their electrolytes okay? That is your sodium, your potassium. Are they a diabetic? Did they not know they were diabetic and they're having problems with high blood sugars? We look to see what their liver function is like. We try to correct the things that we can that are abnormal on these studies. And once we get those corrected, including working on depression, which you can't quickly correct, we look again at the scores on their tests to see if we've improved things for them. It takes a good 6 weeks or so for an antidepressant to start to work if someone's never been on it and they start it. So it's hard for them to continue to take it when they just don't see any improvement. You have to give it time. So once we do give it time, and we also retest things like their thyroid or their electrolytes, or see if they were anemic, if we've corrected that, or their B12, then we check our patients. Next slide, please. Next slide. There you go. So here's mild cognitive impairment, which I talked about before. So people can come to us with a complaint of having some memory loss. And we try to test them to see if we can find objectively if there is some memory impairment. We know that they do have preserved cognitive function. They can still take care of their daily affairs. They're driving without having accidents. We make sure that we ask about activities of daily living when we're assessing people. People with mild cognitive impairment can take care of what we call their ADLs. An ADL is being able to get dressed, to transfer in and out of chairs, to walk, to feed yourself, to take a shower, to take care of what happens in the bathroom. Some people who have mild cognitive impairment may have depression or may have some other psychiatric situations going on. We do refer people to psychiatry when we need to. And as I said before, a percentage of people with MCI will go on to get dementia, but not everybody. So those who are in mild cognitive impairment stage can stay there for a while, continue to function, continue to live on their own, and do pretty well. Next slide, please. Next slide, please. There we go. And here's a little breakdown, a simple one of the dementias. And if you've had the Alzheimer's Association come, they probably showed you some kind of a graph like this. The largest percentage of dementia is really Alzheimer's, but in fact, it's probably most of the time mixed Alzheimer's with, let's say, a vascular dementia. Vascular is when people have circulation problems. For instance, either a big stroke or TIAs, the circulation to parts of the brain is not very good. And on a study, it will be microvascular disease that's mentioned on an MRI of a brain. Alzheimer's shows atrophy, but to truly be diagnosed with Alzheimer's, you need to have specific tests that are done, such as a lumbar puncture and PET scans to look for amyloid. And that's a big deal right now because a new drug was just approved that removes amyloid from the brain. But this costs about $5,000 or upper $4,000 a month. And there is not a clear understanding of how it improves function in patients. It may remove the amyloid from their brain, but may not really result in a more productive and active person. So we have a lot to learn about that drug. Next slide, please.
I think there's just a little lag, but it should catch up soon.
Okay. So with dementia, we find that people have mostly short-term memory loss. And when families bring their mom in, they might say, she remembers great. She can remember everything that happened to her as a child. She can remember getting married. She can remember where she worked. She can remember things from the past so well. But that is the picture of dementia. When memory loss is involved, it's usually short-term memory. And that is what happened last week and what happened this morning. Forget what I ate for breakfast. Can't remember what I did yesterday. Go to the store and can't remember what was on my grocery list at all. Keep going back to buy things. Keep going back to that recipe I just looked at because I can't remember what I just saw. They cannot learn new things. So expecting a parent to know how to use a new cell phone because their phone was old and it was a flip phone that they used pretty well, you buy them a new phone, they can't learn how to use it. Replace a microwave, can't learn how to use it, cannot learn new things. It affects people under 65 and of course, all the way up. Most people have memory loss, such as dementia, a good 20 years before they're ever diagnosed. It just starts very little, very slowly and gradually increases. So we know that when people are diagnosed with dementia, they've had it for a long time. As you can see, as their age goes up, the percentage of people with Alzheimer's or with dementia, I should say, it increases quite dramatically, up to 50% of people who are over 85. Next slide, please. Here's some statistics that I put in from a previous presentation I did. 6 million living with dementia now. It's going to rise to 13 million by 2050. And during COVID, dementia deaths increased 16%. We spent a lot of money on dementia. And unfortunately, the most important thing on this slide is that only 16% of seniors receive a cognitive test in their medical offices they go to. Only 16%. They're also frequently not asked about their weight loss. They often don't get their heights taken, and that helps us know about height loss and osteoporosis. But I think it's so significant that they are not talking about memory loss and not able to do or doing a cognitive test, which is really important because if you don't know where you started, if you don't get that test at your first appointment or so, and something happens, well, you don't know how good or bad you were before. You don't know how much it's changed. So I would recommend that your parents, or if you are over 65, you get a cognitive test to know where your memory is now. And that will help in planning for your future if you do have memory problems. And then if you don't, or you have mild memory loss, then you can work on some things to help you to keep your memory as sharp as possible. Next slide, please. So when you have dementia, and I know they've talked about this before, I've already mentioned that you can't learn new things. You have difficulty with complex tasks. Reasoning is really not going to happen. And you cannot have a reasonable argument and reason with someone who has memory loss. It could only end up in them getting kind of agitated and angry with you. So we say, let it go, come back in 5 minutes and try it again. Their ability to handle spatial orientation, like reading a clock or understanding time, it just goes by the wayside. Can't do it. Language skills can go, and we can see behavioral problems in people who have dementia. And that really can start to interfere with people, especially those who are under 65 and still working, losing their jobs because their behavior or their social norms go out the window too. And that can be serious for them because they're losing their income when they're not even eligible for Medicare. So early onset dementia is for someone under 65. It can interfere with relationships with their children. And it's really important for them to have a good relationship with their children, because as they are going forward, they're going to need that kind of support. Next slide, please. A little bit of confusion on here. He's looking at this letter from the mail. Tell me again why they're increasing our power bill. And she's talking about nuclear plants providing cheaper power. So they are just simply not connecting at all. It doesn't help when you can't see well, you can't hear well, you're trying to communicate, and you also potentially have some memory loss. So that conversation is not going too well. Next slide, please. So when people do have dementia, they are declining in their function along with their memory. It can be fast if it's stroke, where you have sort of a stair-step progression downwards every time a stroke-like event occurs, or it can be very slow and insidious. Not better accounted for by a major psychiatric or systemic diagnosis. So if you can't connect it to something else and the memory loss is progressive, the dementia will overtake everything else. It's going to become the primary reason we have discussions in the office. Level of function is very important for all of us, not just people with dementia. So if we're thinking about brain health, we're also wanting to make sure that brain helps us do everything we need to do every day to get along to the next day. We need as much brain power as we possibly can get. Next slide, please. One of the things we find is that patients don't admit to having memory loss, which I mentioned earlier when we talk about independence and privacy. They really deny they're having any problems. They also deny they fall at home because they don't want to go to a nursing home. And what I see as children will say, Mom's always been this way. She's never remembered names. She's never been good at recipes. This is just her personality, for instance. So there's a lot of denial that goes along with dementia. And that sometimes can prevent us from actually evaluating someone, because they don't want a memory test and they don't want an MRI. They don't want anything because they're just fine. Next slide, please. So as I mentioned earlier, 16% of seniors are never even tested. And in one study, 21% of patients on a hospital ward who had dementia or delirium were not diagnosed in the hospital. It wasn't recognized that they had dementia or delirium, which can kill you. And 20% of non-demented patients were misjudged as demented. So there's not a lot of geriatricians out there. There's not a lot of geriatric hospitalists, though we're training them at Memorial to understand our patients when they're in the hospital and recognize cognitive problems and recognize delirium. And certainly we don't want to diagnose someone as having dementia when they're not. So we need more people who are trained to do geriatrics in almost all fields and understand it, even from surgeons to family practice physicians and nurse practitioners. So there's a push. If you have anybody going into medical school, tell them, please think about geriatrics. Next slide, please. So let's talk about prevention. Get started early, right? I'm going to talk about some myths and some evidence that just doesn't exist for many of the things we suggest that people do. Next slide, please. So this is a truth, but you can't do anything about it. Choose your parents wisely. Now, why is that? So if we're talking about memory loss, we're also going to be talking about genetics. So next slide. We just can't choose our parents, right? When we're thinking about genetics and memory loss, we're thinking about something called ApoE2, 3, or 4. It's the 4 that's the problem. If you have two copies of ApoE4, you have a 2% chance. 2% of people have two copies of ApoE4, and that accounts for 1% of Alzheimer's disease. Now, it's a very small percentage. People do come into the office asking for testing, and that's almost taking us back to when people wanted to be tested to see if they had AIDS, and we had to do counseling before and after people had a test because it was a really significant test to have done. If you're going to tell somebody that you have two copies of an allele that could give you dementia, but you don't have a big chance of actually getting Alzheimer's disease, but it exists at a higher percentage than someone who has ApoE2 or 3 or only one copy of ApoE4, that's going to haunt you forever. So there's a lot to think about if someone wants to get tested for the genetic components of this. What can they do to prevent it? And we're going to talk about that. There isn't an awful lot you can do to prevent you from having dementia. Next slide, please. In general, we tell people to minimize the risk factors. So 3 risk factors that are easy to think about are high blood pressure, high blood sugar, and high cholesterol. So you get those tests done at the doctor's office, and sometimes you need medications to manage these. People don't always take their medicines regularly. Sometimes they don't ever even start the prescription we send in. And it requires ongoing testing to see if those medicines are really working. But it's not just the medicines that you have to consider. You have to think about your physical activity. Only 30% of people over 65 exercise, and that's kind of horrible. Having a balanced diet, it's so easy to go to a fast food place and pick up something quick or just have a pizza. Getting a balanced diet in means you're going to have to work at it, right? Especially if you have kids at home, trying to cook for them, cook for yourself, trying to make sure you get your veggies and your fruits in is more expensive and a lot more work. Lifestyle modification means cutting back on or stopping smoking and controlling alcohol, trying to control those health conditions that I talked about at first, which is blood sugar, blood pressure, and cholesterol. Improving your social activities. That's been hard during COVID to do anything with other people. Folks couldn't go to church anymore. They couldn't go to bridge club. They couldn't go to book clubs. They had to do things online, and it's not quite the same to do it online as it is to do it in person. Even going to the grocery store or to a normal store just didn't happen. Seeing people that you know or even recognizing them with a mask became a challenge. Challenging yourself to be better at all these things. Having goals for yourself is very important, and managing your affairs. That means making sure you have durable power of attorney for healthcare in place and also a living will in case something happens to you and you have made some plans going forward and shared that with your family. How does that protect your memory? It doesn't protect your memory, but it does help to make sure that your wishes happen when your memory is failing you. Next slide, please. Okay, so what fits your schedule? Exercising an hour a day, being dead 24 hours a day. Well, it's not quite that brutal, but sometimes we have to be pretty strict and give real strict facts to our patients to get them to start doing something. And maybe it lasts for a little while and then they forget about it, but that's why we keep having them come back to remind them. Next slide, please. So, what are the components of brain health? You think physical activity, diet, medications, and social support. Let's go through these. Next slide. I had a chance to go through some evidence-based studies. And honestly, when it comes to physical activity, let's say you run or you're doing weights, that's really going to help with that particular part of your body or maybe your ability to run. It's going to increase the blood flow to your heart and to your brain, which is good. But it's not going to necessarily prevent you from getting a dementia. It's going to have good results for you, preventing dementia that hasn't been shown yet. It's important to start small, increase it with time and frequency. Make sure you talk to your provider first and try to have a healthy heart rate and stay in that zone. And use a good, safe method if your balance is off to use a stationary bike versus a treadmill, for instance. Next slide, let's look at that correct heart rate for you. These are usually posted in a gym. Maybe a little hard to see, but depending upon your age, you have a target heart rate zone. That's the heart rate zone that helps you work the best. So working harder isn't necessarily better for your heart or for your overall physical shape. You have a maximum heart rate depending upon how old you are. So try to keep your exercising in the target heart rate zone for your age. And most people have some sort of a heart rate monitor or a watch that helps you know where your heart rate is. That's quite important to healthy exercising. Next slide, please. Medications. Well, medications can help and harm you. What's polypharmacy? How many meds are you on? It used to be polypharmacy was 5 to 7 medications taken in a day. I have patients who are on more than 12, honestly. And part of that is because people are being managed longer with chronic illnesses and are dying because we have medications to help manage diabetes and blood pressure and hypertension. Do you know the interactions and side effects of the medicines you've been put on? Without asking why, what, and how. Sometimes we rely on the pharmacist's handout to tell us, but have you read it? Avoid certain medications such as Benadryl, if possible, anxiety and sleep meds. Sleep meds only give you about 20 extra minutes of sleep a night, but they are addictive. And even some bladder drugs for incontinence can impair memory. The number of meds you're on increases the number of interactions and side effects that you're going to have to. Next slide, please. Of course, on TV, we see a lot about memory aids and supplements and hormones. There's no evidence that any of these work to improve your memory or to prevent dementia. And what they do is cost a lot of money. No evidence that hormones need to be taken to prevent dementia. No evidence in the literature about that at all. Next slide, please. So diet, we talked about that a little bit. You can manage your chronic illnesses through food. Always check guidelines and look at your labels. Control calories, that's very important. If you want to start walking and running, every time you hit the floor with your foot, you are hurting a joint if you weigh more than, let's say, you need to. Avoid fats, red meat, salt, and sugar. Sugar particularly is so easy to consume in sodas and sugary drinks. We don't even think about it. It's not like you're having a soda or a piece of candy, but you consume so much sugar. Look at how many grams are in that bottle you just picked up. And try to eat more fruit and vegetables, particularly nuts, and use healthy oils such as monosaturated oils, olive oil, and some nut oils too are healthier for you than hydrogenated fats. Next slide, please. So overall, trying to have a healthy lifestyle helps to promote a healthier brain, but doesn't prevent dementia. Check your vitamin D level through your physician's office or nurse practitioner, and your B12, because I told you B12 can impact your memory if it's low. We don't use B12 as well as we age because we lose something called the intrinsic factor in our gut that helps us use the B12 in the food that we eat. So even though you're eating your vegetables, you may not be able to process and use the B12 that's in the food that you eat. If you have vitamin D problems, it could be that you're not getting any sun on your skin. You should try to do that at least twice a week for about 10 minutes. So if you're consuming dairy products, yogurt, milk, or you're taking vitamin D, the sun factor on your skin is really important to utilize that vitamin D. And vitamin D is important not only for your general functioning, but to reduce your osteoporosis risk. And supplements have no evidence that they are going to improve your brain health. So don't spend your money on them. Next slide, please. Social support, as I mentioned, can be associated with a longer life and hopefully a healthier life. A lot of the studies that were referred to were from the 2000s. It's not going to prevent dementia, but there's an association between cognition or how you think and social relationships. The older studies from the 2000s said you have to have social support. It's vitally important to good brain health. We don't have the real evidence on that. A lot more studies need to be done, but it certainly doesn't harm us to have social support, someone to rely on, someone to eat with, somebody to help you when you need a ride, a friend in the neighborhood. It's important in so many ways, but preventing dementia, not so much that we know of right now. Next slide, please. There's no evidence that any of these puzzles or cognitive training is going to really improve your cognitive function, but if you do puzzles, you get better at doing puzzles. Learning to speak another language is fun. I'm doing it right now. I've been doing it for a year. And if you like to play bridge, you get better at it, you'll beat your friends, but there's really no evidence that it's going to benefit you in terms of brain health, unfortunately. Next slide, please. So we can look at this as the glass is half empty or half full. If you like or want to start exercising and you're interested in eating more healthy and you want to cut down on the medications that you take and have a better social life, that's all positive. The evidence just unfortunately isn't there yet, but there'll be more research to help us understand how these impact our brain. Having a more positive outlook is a good thing. So it's better to be half full, I guess, than to be half empty. Next slide, please. So getting older depends on how you look at it. 65 isn't the 65 from 20 years ago. I have patients who are in their 80s who are more active than some of my patients who are in their late 60s and also in better health. I have patients who wake up every day and say, this is better than the alternative. Everybody has a different attitude about getting older, but getting older isn't and doesn't have to be a negative. How active you are, how you take care of yourself is most important in all of this. If you notice signs that you're having problems with your memory, talk about it with your provider. Get that cognitive screening done at some point so you know if there's something that you need to have investigated even further. There may be a reason that is metabolic, maybe a medicine you're on. It could be something that we can change, a reversible reason for having problems with your memory. And the only way you'll start looking at that is if you start talking about it. Next slide, please. So I think that might be the only one. So thank you. I don't have the ability to see the chat, see if there's any questions.
Okay, so if you do have any questions at this time, definitely feel free to add those into the chat box. Or if you'd like, we are a smaller group today, so you can always unmute yourself to ask your question if that works for you. I will go ahead and kick us off with the first question, and it is about caregivers. So you mentioned caregivers quite a bit throughout your presentation, and for those who maybe don't have family members that could be their caregivers, what would be some characteristics or things that you may want to look for in a caregiver? Or where do you even start with finding someone?
Good question. So one of the big things to know is that Medicare does not cover the cost of caregivers. That is pretty much an out-of-pocket cost for most people, unless they have Medicaid, and Medicaid pays for people to stay with you in your home. It's important to find somebody who is bonded so that your personal items in your home are generally you're going to know you're safe because they have a good background. Going with an organization, a company that does caregivers, especially if you rely on them to get in and out of the shower or to help you get dressed and things like that. You want somebody to come. You don't want them to call in sick all the time. So if you work with an organization that provides people who can come in your house and have been bonded and trained to take care of you, then you know you can have a backup person because there's a supervisor for that. Instead of using somebody from the neighborhood or someone from church or somebody else used once and their father had come to their house. Language is important too, because sometimes if you need someone who's going to speak Spanish, you don't want someone who comes to the house who can't communicate with you, right? Whatever your language is, you need to have somebody, perhaps that means somebody from the community, but going through a company that does this and trains caregivers is one of the best ways to find somebody who's going to be safe and able to be responsible in taking care of you. Now, on the Medicaid side, there are companies that have registered with Medicaid. They are provider companies, and they will assign somebody to be with you and provide a certain number of hours a week. Usually they can be there if there's a family member who works, they need to go to work. Sometimes you can get a caregiver to be with a family member during those work hours so you can actually hold your job. Okay. And Medicaid will pay for a family member to be a caregiver.
Oh, okay, that's good to know. Okay, so my next question is about family, actually. Whenever someone is maybe diagnosed with dementia or is beginning to suffer from memory loss, that can be very stressful on the individual, but also on family members. So is there any advice that you would offer family members of those who are suffering with memory problems?
Yes, it was easier before COVID to find support groups, in-person support groups. There are many at churches, and the Alzheimer's Association can probably refer you to a support group in your area as they start to become in person again. I would recommend to read, still pick up that book, the 36-Hour Day, I think it's called. And you don't have to start or stop at any particular place in that book. And it's people's real life stories. So you know you're not alone. There's other people experiencing what you're experiencing. Alzheimer's Association has a 24-hour support line that you can call. So if it's 2 a.m. and your family member is driving you up the wall and pacing and trying to escape out of the house, there's somebody you can call for advice. And go to their website. They have information for all different kinds of memory loss problems.
Okay, thank you. The final question that I have is around the mild cognitive impairment test. Can you describe maybe what those tests would look like?
We have several cognitive tests that have 30 points. And it's scored so that maybe 30, 29, 28, 27 is all normal. And then you get into lower numbers, that's mild cognitive impairment. So these are tests that ask you to do various things. Memory test, maybe subtracting by serial sevens, or you're having to listen to a story and remember it, and you have 4 questions to follow, for instance, drawing a clock, naming as many animals as you can in a minute. There's various questions from math to spatial relations to short-term memory questions. And then we add those all up and come to a final score from the clock to the questions that we've asked. It also includes, do you know where you are? Do you know the date? Do you know what year it is? What state are you in? All those sorts of questions get asked, and we come up with our final score. So that's how we know if somebody's screening result is in normal, mild cognitive impairment, or actually in the dementia range. And also, I believe you have to have at least a high school education for some of these to be valid.
Okay.
We take that into consideration too. And they do come in different languages, a lot of different languages. We sometimes will have a family member ask it because I can't pronounce words in other languages as well as a family member can, and we guide them to go through it because we want to be fair to our patients. You can't ask them a screening test in English if they don't speak it.
That makes sense. Okay, well, those are the questions that I had. Actually, I do have one final question.
Okay.
If you could provide us with just a little takeaway or a final wrap-up message, something you want us to leave this presentation with.
So though there's no evidence that exercise and eating well and being a healthy person prevents dementia, what it does do is keep you as vibrant and able to cope with the things that are going to come in the future, because we're all aging every day. And if we can keep ourselves as healthy as possible, eat healthy, if you can't get on a treadmill, but you can walk in your neighborhood, do it. The more you move, the more you take care of yourself, the healthier you're going to be when the unexpected happens, and you'll be able to bounce back or endure it better. So be as healthy as you can and stay active.
Thank you so much for presenting for us today. We really appreciate it. This was a wonderful presentation. And I know that you had some compliments in the chat saying how great it was. And so if you are like me and you walk away from a presentation and then a day later or a week later, you think of a question, you can reach out to us at healtheducator@thewomensfund.org, and we will work to get your question answered. I have also provided a survey link here. This link will be sent in a follow-up email. We would really appreciate if you would take a moment to complete the survey for us and let us know how we did, things that we could improve on, and topics that you would be interested in hearing about. The second and final oh, sorry about that. Go ahead.
Thank you.
The second and final presentation of our Brain Health Awareness Series is going to be next Wednesday, same time from 2 to 3, and it will cover the topic Alzheimer's and your brain. So if you're interested in that, I encourage you to visit our website and register. But Dr. Beck, I want to thank you again so much for joining us today. We really appreciate you taking the time to speak with us.
You're welcome. It was a pleasure. Thank you, everybody. Bye.